According to the Department of Labor, urology is the #1 most stressful job in America. Can you believe that? Here to shed some light on that job, but also provide men with some health considerations in 2023, we've got Dr. Adam Childs. Thank you so much for joining us.
Morning.
Yeah. So remind us what you all do there at Arkansas Urology.
Well, pretty much all things urology. I'll be honest, I don't think I knew what a urologist was until I was a couple years into med school. So I think a lot of people, if they've not seen the urologist before, probably don't know much about what we do. But essentially, we're the surgical specialists of the urinary system. So think kidney stones, kidney cancer, bladder cancer, prostate cancer, reproductive related issues like erectile dysfunction and infertility. So quite a few things that we help people take care of.
Yeah. And Dr. Childs, we just read that statistic that you all sent over to us, that urology is the most stressful job in the U.S. Is that true?
Well, it's true according to the Department of Labor. It made a little bit of headline in December when they released an annual study about most stressful jobs, and urology came in #1. And I was a little surprised that urology was #1. I was not surprised it was considered a stressful job. And as I reviewed that whole list, when you look at the top 10, almost half of them or over half of them are all healthcare related. So several of them are surgical fields. And so I do think it's a stressful time to work in medicine, both for the nurses and the physicians and the surgeons. But apparently urology is the most stressful job in America right now. And I couldn't get much detail on how they came to that conclusion, but I can certainly shed insight into some of the things that trigger stress or things that we deal with on a regular basis.
Yeah, certainly. And I know one of those things that can generate stress, obviously, in a lot of families is cancer. I'm wondering if you have any statistics you can relay to us about specifically prostate cancer.
You bet. Well, we certainly take care of a lot of different types of cancer that affect men in critical and intimate ways, but prostate cancer is a big one. It's the #2 cancer killer among men out there, so it's quite common. And most men and women, as they get older, will know someone who's afflicted with prostate cancer, has had to go through this. And fortunately, some of it's less aggressive and can be watched, but unfortunately, some of it's quite aggressive and needs surgical treatment or radiation-based treatment. But it's about 1 in 7 men will deal with prostate cancer in their lifetime. And again, the #2 cancer killer among men out there. So it is a serious concern and a serious issue we deal with on a daily basis.
Sure. What if, as viewers are watching, and they're like, you know what, it's time, maybe I need to get screened. What's the screening process like?
Well, screening process is pretty easy. Typically, it involves some blood work for what's called prostate-specific antigen, or PSA. A lot of patients, general docs will be checking this. Some do not, based on some controversies and screening recommendations, but we do recommend that be done on occasion in conjunction with a discussion with your physician. The other thing we recommend is a prostate exam, and a lot of guys are familiar with this. They certainly joke about it. Certainly not our favorite thing to do, and we'll be the first ones to try to wiggle out of that, if you know what I mean. But at this point, typically a digital rectal exam to feel that back surface of the prostate is critical, in my opinion. And I find people every month who have normal PSAs but have distinctly abnormal exams who turn out to have notable prostate cancer.
Are there some warning signs that men should be looking for, Dr. Childs?
Absolutely. I think the most common symptoms we see are changes in urinary habits. And so although a lot of that will come from age-related issues regarding bladder health and enlargement of the prostate, one of the first things we always do is rule out prostate cancer. And we find a handful of people every year who seem to present with enlarged prostate symptoms who really have urologic cancer, is oftentimes prostate cancer, but also bladder cancer. So I'd be concerned about blood in the urine. I'd be concerned about any microscopic blood in the urine, and I'd certainly be concerned about any obstruction type symptoms in terms of changes to the stream, straining, urgency, frequency. So I think it's important to kind of know our bodies and know our baseline symptoms. But if there's a distinct change in symptoms, especially over a few years or less, I get concerned about prostate cancer.
Sure.
Yeah, that's great. We're going to have some information for our viewers to reach out to you. You're here in Northwest Arkansas, is that right, Dr. Childs?
Yes, sir. Yep, we got offices in Fayetteville and Bentonville, and do quite a bit of all things urology, especially urologic oncology. But I would love to see if you have concerns in that neighborhood.
Yeah.
Sure.
Well, thank you so much for joining us and bringing these conditions, these issues to light. It's going to be a great way for our viewers to consider starting 2023 off on the right foot.
Yeah, absolutely.
Yeah.